professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with a joint faculty appointment with Ross University School of Medicine. And in this video, I'm going to be going over a nationally representative data set, but more specifically focusing on children and adolescents. And so the name of this is Youth Risk Behaviors Survey. And this is part of actually, now this is, if you ask me, confusing nomenclature. And one of my PhD students actually ran into this problem of identifying what was YRBS versus YRBSS. So the surveillance system, the broader surveillance system, is known as YRBSS, whereas the actual data set, if you're referring to that, is YRBS. The reason I'm showing you this visual here is because this is kind of a quick and easy way to look at some of the various broader topic areas. So for instance, unintentional injuries and violence. This part rarely or never wore a seatbelt. That's one. Rode with a driver who had been drinking alcohol, drove when they had been drinking alcohol, or texted or emailed while driving a car or other vehicle. So these are all sources and reasons for unintentional injuries, and you can quickly, just so quickly, create a graph which will show you the unintentional injury and violence rates. And I might have spoken too soon, as this is not proving to be very quick. And usually by now there's something there. So instead of waiting, let's take a look at a different topic. And maybe that the server for the Centers for Disease Control is currently acting up. Yeah, but you can go into these. Now, this also gives ideas for interventions. So carrying a gun, or electronically bullied. Perfect example of public service announcements that can be implemented. Were ever physically forced to have sexual intercourse or experienced sexual violence by anyone. Even dating violence is part of this. Seriously considered attempting suicide or suicide attempt resulting in an injury, poisoning, or overdose that had to be treated by a doctor or nurse. So these are all different areas. Now, if you want to focus on tobacco use, just tobacco use, not only are there questions about cigarette smoking. I actually did a large-scale study on high school students on cigarette smoking, but also now looking into vaping products, smokeless tobacco. Many of the tobacco companies make vaping more enticing by providing flavors, fruity flavors, and whatnot, which provide more sort of an appeal. Smoking more than 10 cigarettes per day, that makes a difference. Smokeless tobacco, cigars. Then the topic of alcohol and other drug use. And this goes into prescription pain medication questions, illicit drugs, steroids, cocaine, marijuana, heroin. Then we go into focusing on sexual behavior questions. Now, when we're thinking about sexual behavior, it's also reproductive sort of considerations as well. So, of course, questions surrounding sexual intercourse are there, but also the implementation of intrauterine devices, for instance, the Mirena or Paragard, or some sort of implant before intercourse. So there's actually extensive history taking, depending on if you are within the specialty of family medicine or obstetrics. Some of these are more detailed questions that you end up asking. And some of these birth control procedures I've actually been a part of within some of the rotations. And so also being tested for HIV and some other STDs. Some of the more common ones. Then we go into dietary behaviors, and I've talked about milk and fruit juices and things like that. Physical activity, just wrapping up. How often were you physically active? What was it, 60 minutes? Attended physical education classes on all 5 days. Had a concussion even. Obesity, of course, there's only 4 there. And just wanted to check to see if those work. And then you can go into all topics at the same time. There's other health topics. That goes into asthma, sleep disturbances, applying sunscreen regularly, and having allergic reactions, and indoor tanning devices. So there's, as you can see, even though this has been subdivided into 8 categories for you on the left, the fact of the matter is that there's a lot of areas that are being covered, and there's much potential for research questions. And so when you're thinking creatively, you might be thinking about one particular data set that you want to specifically focus on. For instance, if you're exploring asthma or childhood obesity or some of the chronic conditions that affect children, then you can try to understand that better. Or if you're trying to understand more adult conditions, then I would recommend you more heavily rely on National Health and Nutrition Examination Survey and Haynes, or Behavioral Risk Factor Surveillance System, BRFSS, for those types of information. Having said that, childhood information can be gleaned from both NHANES and BRFSS. Thank you for listening.